We report a geriatric profile of older patients with cancer in MARONI River Basin in French Guiana. Saint-Laurent-du-Maroni Hospital is a remote hospital in western part of French Guiana. The population is multicultural. Patients older than 17 represent around 20% of cancer patients. We performed a multidimensional geriatric assessment, and we studied retrospectively more than 100 patient procedures during a 6-year period. The G8 tool was used for frailty screening, and the multidimensional geriatric assessment was performed in 40% of the patients, and we classified health status according to different classifications. Patients are in majority of male gender. G8 was performed in 70% of patients, but it is noteworthy that 5% of these patients had G8 more or equal to 15. Performance status was poor, and we observe also that comorbidities were frequent. Around 40% of patients had more than 2 comorbidities. No dependence in ADL and IDL was only observed in a quarter of patients. Malnutrition is frequent around 50% of the patients. And there are weaknesses of geriatric assessment procedure. They are linked to a problem of language and maybe to question of different culture. And we observed also that interval between geriatric assessment and last follow-up was less than 6 months in 50% of cases. The analysis of the classification highlights 3 major points of questioning. First, more patients have an altered health status. The discrepancy of the number of fit patients in the SAOG classification compared to those of 2 other classifications suggests a poor discrimination in non-Western population of the G8 frailty screening score, higher or equal to 15. This fact was observed in another study presented by our group in an oral session of this meeting and recently published in the Journal of Geriatric Oncology. And third, the discrepancy in the number of vulnerable patients in Balducci classification may be related to the fact that patients in this group are supposed to have little impact on dependence, whereas our patients are very often dependent on ADL. These findings invite to analyze this classification in non-Western population. In conclusion, a geriatric assessment allowed decision-making of active management of patients in 64% of patients. 2/3 of the patients had generally a poor health status. Unfortunately, geriatric assessment was performed too late. And finally, geriatric assessment, in our opinion, is in this context appear as the best procedure to screen health status. I thank you for your attention.